So how did we get to that serious situation? I'd say it was a case of too little, too late. We are forever playing catch up because we lost the opportunity to control the pandemic early on. We told them that you're doing the right thing. Only you need to do it at scale, with speed, and with everyone working together. We also told them that they needed to ramp up their campaign for community participation. And they needed to make sure that the public co-owns the problem. And they could have done this with better risk communication, behavior change communication, and they could have changed whatever it is that wasn't working very well if they had a feedback mechanism.
The Philippine Institute for Development Studies has also released a study recently that estimates 1.5 million Filipinos will be sliding back into poverty due to COVID-19. Again, all of these facts and figures emphasize that COVID-19 health pandemic has actually created massive economic contraction and also reduction in welfare and also impact on many businesses and many workers. The Philippines, like many other developing countries, faces triple challenges of social, political, and economic inequality. And this existed even before the COVID-19 pandemic, but the pandemic has a way of exacerbating and making it worse. So, for instance, the doctors tell us to keep on washing our hands. But do you know how many Filipinos have access to clean drinking water and running water at home? How many of us have that luxury? How many of us do not have that luxury? And so I think the behavioral change will also follow the environment, the enabling environment for some of the behaviors that we want to reinforce. So my fear is that if we do not strengthen the public goods aspect of the new normal, we will have, as a new normal, a more unequal society. The poor and low income will have an even tougher time adjusting. To look at the beginning of the pipe, access to assets, looking at education, looking at health, even at the 0 to 5. So I think the yield for lowering poverty and lowering inequality is actually much greater if you look at the beginning of the pipe.
This thing, COVID, is going to keep running, and it is going to come and go and come and go. And only with really active mitigation efforts will we ever slow it down. In the end, it is really up to us. Thank you very much.